Good job. Yeah, I'm trying to see the ones that are with the 35s. Let's try. Hi, hello. Do you have an appointment? Okay, well, let me check you in the system. What is your name? Yes, full name, please. A beautiful name, actually. Date of birth? It's your first time here in our clinic, as I see. Well, welcome. And reason of your visit today? Looking for an ear checkup? Oh, okay. You've been having some issues previously and had some treatment done? Oh, I'm so sorry to hear that. We haven't been working quite well? Okay. Let me just finish this information here. Well, talk to me about your issue while I prepare myself. Your ears clog quite a lot. Very often. How normally do you clean your ears? And how often? Oh, you've been told that you have a reproduction of earwax. Have you ever been asked what is your normal diet on a daily basis? Sometimes there can be a link between what we eat and how our body reacts to it. Certain foods tend to create more fluids in the body or retain them, like with sodium, salty foods. Okay. And right now, do you feel any pain, discomfort? Mostly discomfort. Okay. And is both ears the issue or just one? Okay. So both are the same. Normally in this type of cases, the issue tends to be mostly on one side, but it's quite rare to see both ears having the same issue. Okay, so we're going to start by inspecting your ears. Very well. Let's try this area. Oh wow, okay. There's a buildup right in the entrance of your ear. Now it's quite hard, so we definitely need to do a very deep cleanup. Let's see the other ear, okay? Looks like it's the same. Quite a lot of buildup in this ear too. No, I believe that what we can do first is a solvent. They, in your other treatments in other places, have they treated you with the solvents in each ear, or it has just been regular cleanup? Okay, so do you happen to remember what type of dissolvent they have been using? It sounds like a bubbling. Okay. I think I know what they are using. Okay, let me just go grab the solution for you. Okay, one moment. While that happens, I am going to prepare you here. Now let me know if you're comfortable in that position. Yeah, very good. Now in your case, we're gonna try and be very, very soft with your ears because they are in a very delicate state regarding yeah, okay, I think this is gonna be the one. This is quite strong. I don't normally use it in a lot of patients because of how strong it is, but in your case it's definitely necessary to clear up a pathway so we can gain access to the inner part, okay? Normally at this stage you're not going to hear that bubbling sound that you were talking about. Okay, let's give it a moment. It only takes a minute to start working out. Okay, I'm gonna be putting in your registry what we are applying in order to have a log of everything used today and for future references too. Do you feel any tingling sensation in your ears right now? Okay, that is normal. So yeah, don't worry about it. Okay, let's try to check if we can gain access. Normally acts quite fast. Okay, let's see here. Yeah, it's quite difficult. Yeah, it might need a little bit more. Let's try with this. This is just an aid for the serum to start acting faster. But in your case, it's rock solid, so it's quite difficult to actually remove it and soften it up enough for it to work. Very well. Let's check again. Hopefully this time it's better. Okay, it has opened quite enough for we to gain access. I'm glad to see that your ear walls are actually quite nice, but there's definitely a lot of earwax. Quite full. This side too. We're gonna require to do a full cleanup. While we do that, we're gonna be inspecting the ear quite deep. Now, this procedure, as I'm assessing right now, it's gonna be quite difficult. It's gonna require a lot of precise work because it's the earwax that you have is not soft as it would normally do in most cases. On the situations, we will do an irrigation to clear that up. But right now, it's like crazy glue stuck into your ear canal. And this needs to be removed by hand. And it's a very, very delicate matter because of how stuck it is to the ear wall. We need to scrub very, very slowly for it not to damage your ear wall. If we do it fast or not delicately enough, we can damage and cause maybe a cut, and that can lead to some infections in the ear. So we want to avoid that. Now we have two options here because of how delicate this whole procedure is. First, it's sedate you. It's not a full general anesthesia. It's something that is going to make you feel drowsy, even a little bit sleepy, just to calm you down. This way we can work without having you to move or breathe too fast, because all movements can alter the job that we are doing in your ears. The other is going solo without medication, but I don't know if something that you would like to go with. I know that you have some experience on ear cleaning, so leaving this on you and giving you the options. You think you can do it a week? Very well. So let me just fill up the information here on what we're gonna do. We might also use some dissolvents while we are working inside your ears. Okay. For you, I think it will take around 15 to 20 minutes, depending on what we find inside. We're going to be using specialized tools, all mechanical. This time we are not be working with cameras because of how delicate this is. This way we can actually do it in a most soft way in hopes that we will not be breaking skin inside your ears. And I'm saying this because you have a high risk of infection with this because of how infested it is inside. I don't want to scare you, but it's quite delicate right now if you haven't had an ear cleaning in some time, right? You used to have them every 2 to 3 weeks, as you were telling me. And when was the last time that you had one? Oh yeah, that's a lot of time. Okay, so let me start by putting this here. And also in this area. I'm gonna do a hearing test. I just want to make sure that your hearing is not impaired with all this buildup of earwax, okay? I'm gonna whisper a few words into your ears. Repeat them after you can hear them, okay? I'm sure that you have tried this and done it quite often, right? Okay, let's begin. Purple, purple, red, house, doctor, blue, purple, purple. Okay, good. Blue, blue, red, purple, purple, red. Okay, I believe there is a certain level of impairment. I would say 20-30%. It's not much, but it's definitely not normal and not good that you have this impairment, okay? So we're gonna send you to the treatment room. Here you're gonna be laid out, and while we're doing the treatment, it's very important for you not to talk. We're not gonna be talking to you either because of how delicate this is, okay? If you can follow me this way, please. Okay, now in this position, are you comfortable? Maybe do you want to move the chair a little bit more? Are you okay like that? Very well. So from now on, let's start. Try not to move, stay still. In case you need anything, please let me know. Are you ready? Very well. please. Hi. You took a little nap, isn't it? Yeah, it happens, don't worry, and I'm sure that you're also very used to it. Well, I'm very happy to say that we were able to clean completely your ears without damaging the ear walls. Actually, they were in great shape. We were using some of our syrup that helps soften up and actually soothe the ear canal. And I think it's gonna help a little bit not to let the future earwax to get stuck into the ear walls. Right now, the earwax that you had, it was like there were claws on it grabbing into your ear wall. But luckily, we were able to completely extract it. So I'm gonna send you home with drops for a week time. This is just to soothe the ears. You're gonna place 1 drop on each ear before going to bed. And I'm gonna put very easy instructions to follow. You can pick up your prescription right here in the lobby. Now, it's very important not to take too long before your next ear cleaning. I will say at least 2 weeks, if it's possible. Do you have any questions? Oh, it was my pleasure. Thank you so much. And right here in the lobby, they can help you with the next session. Of course, take care. Hi, how are you? Okay, so let's pull out your medical history. Yeah, we were expecting you. You are a very, very special case. Okay, we had a few biopsies of your ears. Quite interesting. Now, the analysis came out inconclusive, so that's a bit odd. Normally, we tend to find some clues in this kind of biopsies that we do of the earwax in people's ears, but with you, it came out actually completely clean, meaning that it's just regular earwax. So, tell me how you have been feeling these past weeks. Still struggling with that? Not able to sleep properly? Okay. And your last ear exam was when we checked you out? Yeah. So we did this ear exam around 2 weeks, more or less. Yes, let's see the date here. Okay. How about headaches? Have you been struggling with that too? Feeling dizzy? Okay. How about when you're walking? Do you feel like the floor is moving a bit? Okay. Well, let's start by checking the ears. Let's see how it's right now. Now, remember the last time we had a few troubles to check you in because of fat impacted earwax. Hopefully there is not now. Okay. So both ears are the same with you, so yeah, you are actually presenting the same problem. Yes, definitely. It's completely covered. a very hard earwax wall, which we call impacted ear wall, and I'm pretty certain that you're familiar with that. Yeah, okay. In these cases, as you know, we need to remove that impacted earwax first so we can check out the ear and see what we can do from there. But as I'm noticing, these ear walls are starting to grow faster since your last earwax cleanup was 2 weeks ago. So definitely it took less than a week to grow back. Okay, I'm gonna check the other ear in a moment, but I'm sure it's gonna be the same case. No. We're gonna have to go on and treat your ears for the impacted earwax. Now we're gonna have to be a bit more severe and aggressive with this, since I noticed that it's harder than before. Okay, let's see the other ear. Yes, definitely the same situation. Rock solid. Now, a more severe treatment. It's going to consist on the same medication that we applied before to soften up the area and be able to remove it. But it's going to be a bit harder to take out because every time we do this, it comes back harder and harder. Yeah, I'm not able to even look inside. The issue is very, very severe. Now, before we proceed with the cleanup of the entrance, I would like to do an ear exam, your hearing exam, I'm sorry, and see how it's affected. Let me check your history here. I do remember that we had issues with that in the past. Yeah, you normally wouldn't notice it per se because the change and the hearing loss, it's very, very slow in your case. It happens almost like in a period of 2 weeks that it slowly starts capping the area. So you don't really notice when it's that slow, the process. But I'm sure that there is a hearing loss. Yeah, I do see here that in past sessions you struggled with that. And it's actually getting worse the more exams that we do because it's getting harder and harder. So the layer, it just keeps the sound from going inside. You kind of tend to hear it a little bit muted, isn't it? It's kind of normal for you. Yeah, we get used to it, we get by. The human body is just extraordinary. It gets used to everything. So, let me illustrate you what is going on right now. So this is your ear. This is the internal part of your ear. Now right here in this entrance, normally we will be able to check right here inside of the ear canal. But in this part, which is the right entrance, it's a wall of petrified, and I would say this, petrified earwax. It can hurt when it's touched. I saw you twitching a little bit. So what we need to do is completely clear the area and gain access to the inside. Now in the past with you, we noticed that this area was a little bit red, but that was from the earwax sticking to the ear walls, and some cases going into the inner ear here. So this is what allows us to hear. Okay, in your case, all this is trapped with earwax, this ear wall. So we're trying to liberate this part. And as I was telling you before, very important, especially in your case, not to use cotton swabs, because what you're doing is just pushing and pushing the earwax all the way inside, making it harder and harder and harder every time because of your earwax overproduction. So we want to avoid that. But in your case, the production is just so let's move ahead and do the hearing test. You can barely notice, right? Yeah, that means that the ear wall, the wax ear wall that you have is getting wider with time, meaning that the sound cannot travel inside and be captured. So, as I was telling you, we're going to be using this new drug that hopefully is going to soften the earwax faster. It's more or less the same as we did before, that you felt that sizzling sensation in your ear, like something's cooking. It's gonna be similar to that. Also, it might get a little bit wet, so let's protect your clothes beforehand. Okay, let's put this here. I'm going to put one on each ear. Okay, so try not to move while we do this. Thank you. Okay, very good. I'm gonna apply it directly here. Very good. Good. Now this one takes a bit longer to act than the other drugs that we applied. So you're not gonna start hearing that sound that I was telling you about. Okay. I would try not to move, okay? Very good. So let's get that acting up. Normally it takes around a minute to start the dissolving process. You should be hearing it in a moment. Now let's see. We're gonna have to leave it for a couple of minutes. I don't like to scrap in this situation and scrape the area because it's so delicate for you. So hopefully with this new drug it's gonna help quite a bit and be dissolving on itself, and hopefully even a little bit in the inside, but we're gonna check once we are inside there. Okay, yeah, it does sounds like that, isn't it? Like something is cooking inside. Yeah, it's a solvent that works on the earwax and just makes it melt like honey. Because right now it's, well, not right now, but it was petrified. So what this drug does is soften it up, making it like very, very soft, even liquid. That's why I protected your clothes, because sometimes it can be dripping a bit. Yep, there it is. Okay, let's clean you up. Good. That's interesting. It's more clear this time. Which it's a very good sign. Okay. Let's let it out a little bit more. Let me go get my other tools, because I'm pretty sure that this is gonna end up with another profound and very deep ear cleaning. Okay, just one moment. Normally it takes less than 5 minutes, so 3 more minutes should be okay. 1 second. Okay. How are you feeling? Yeah, you're used to it. Okay. Guess it's time to inspect the ear. Very good. Try not to move, okay? Yes, it's quite a lot. There's a big build-up. Don't see much redness. I got dissolved a little bit, but and it's quite an extensive and quite severe cleanup. It's filling up faster than before. So let's move like this, okay? Now here is the same issue. Both ears are exactly the same, to be honest. Listen, this situation can be good because it's telling us that this might be just a normal process for your body, that it's just overreacting. Maybe someday you got a little bit of dust inside and your ear starts overreacting. I don't know if you know how pearls are made. When a clamp gets a little grain of sand, just one grain, gets inside of them, their bodies react in this very violent form, creating this protective layer around them, which is the pearl, to protect their bodies from the sand grain. So what is happening with you, it mimics that when there's a foreign object or something, let's say a little tiny bug went inside, or a little bit of dirt went inside, or a bit of water got inside, your body overreacts to this. What we normally would do, a normal body will do, is just create a little bit of earwax and try to dispose of it. But yours, it's completely shutting down the ear, covering it with the most earwax possible to protect the ear. It's like a very overprotective parent, your ears. But since we've been doing a lot of testing, a lot of exams and biopsies, and we haven't found anything, and both ears are exactly the same situation, I would say that's a good theory, that your ears are just overreacting to this, and it does cause a little bit of problem with the hearing loss and maybe not making you feel the greatest. But I think we can work out a way to prevent this with more ear cleanings through the month. Normally with you we go every 2 weeks, right? 2 to 4 weeks sometimes. Okay, oops. Let me just work out something here. Will you have time to do it once per week? And I know it's gonna be a very hard routine to maintain once per week, a cleanup, but I'm not saying a medical cleanup that you have to come to the clinic, wait, and stuff like that. No. There are salons and these beauty places that have this service of ear cleaning. Let me see if there are some around here. And they can be covered by your insurance. Yes, if we make the form, send it to your insurance provider, we can make it free for you. You just have to be there and get the ear cleaning, and can be even relaxing for you because you're doing once per week and not every 4 weeks. When the earwax is harder and is more difficult to remove, and this way once per week we can try and see if it works, maybe even slows down the process. Or we can teach you how to do it yourself at home, but sometimes it can be difficult. Okay? Yes, it's more relaxing when someone does it for you, isn't it? Okay, there is a few beauty parlors here that offer that service. I'm trying to read here if it's something that could help you. Okay. One moment. Nurse, can you come here a little bit, please? Thank you. Yeah, I'm gonna ask my nurse to look up this information while I do your cleanup. Yeah, with us, normally it takes around, what is it? 10 to 20 minutes to clean your ears, right? Yeah, because it's so full, especially right now, it's quite severe. So with this service, you can do it in less than 10 to 15 minutes. And in a relaxing way. Oh, hello, nurse. Well, I need you to do me a favor, please. Can you look up the beauty parlors around us that offer ear cleaning sessions? And can you call them and ask them what kind of service is their ear cleaning? Yeah, okay, thank you. I need information in around 20 minutes. Yeah, okay. So we're gonna be preparing you for that, okay? Now in your case right now, it's harder than usual, so there's gonna be a lot of scrapping there. Yeah, this time it's a little bit difficult, so we're gonna be using our drops and probably other tools that you haven't been noticing before. You're a veteran with ear cleaning, so you know, try not to move or sneeze or talk during the process, and just enjoy it, okay? Let me just recline you. Okay, you're comfortable like this. So, I have quite a lot of experience with you, so I know that you tend to fall asleep during the procedure, so don't worry. Everything's good. We already know how it works. Just try not to move, okay? Very good. Okay, I'm sorry to wake you up. I'm gonna remove the towels from your face. Throw it up because I noticed that you fall asleep. How are you feeling? At this point, it's relaxing just for you, right? Yeah, I know how it is. You've done it so many times that you're just feeling like a lullaby. Okay, so the nurse gave me the information here, and we found a perfect candidate place that can do it for you in 15 minutes, okay? I'm gonna do the research, and I should be calling you in around a week to tell you that we're ready to start this experiment. We're gonna try this experiment for a month, okay? During this month, we are gonna be doing 4 ear cleanings, and in this place, yeah, not with us. And hopefully this is gonna work and slow down the process. We're gonna experiment with this, and in the 4th week you're gonna come with us, and we're gonna be running some tests and we're gonna take some samples too to see how it works. Okay, I'm gonna go home with drops for that redness that I noticed, but that's it. Everything seems fine. And that sensation that you were dizzy and you were not being able to sleep is gonna fade out, you know. With the pressure from your ears gone, you're gonna be able to sleep soundly. Do you have any questions? Well, you already know how the drops work, so please use it every night before going to bed. And next week, today, we're gonna start the first round of cleanups. Don't worry, we're gonna call you with information and how to do it, and you're not gonna have to pay out of pocket absolutely anything. It's gonna be covered by your insurance, okay? Any other questions? Well, it was my pleasure, and I will see you in 4 weeks, and in a week my assistant is gonna call you. Okay, please take care. Bye bye. You're a referral, right? Nice to meet you. I'm Jonie. I will be your ear cleaning technician today. Okay, so you're referred here from Dr. Whisper's office, correct? Okay, you are under treatment for an issue with your ears. Okay, severe ear cleaning clogging, causing headaches and insomnia in some occasions. I'm so sorry to hear that. Yeah, when we are losing our sleep, it's not fun at all. Okay, so Dr. Whisper is trying to do an experiment with you, which consists on cleaning your ears every 2 weeks. Before, you were only getting your ears clean whenever you felt that it was needed, that you felt that it was too much, right? And that how often what was happening? Every other month? Okay. So it was nothing constant, right? Whenever you got to a point that it was unbearable for you. So sorry you have to go through that. Very good. So Dr. Whisper was putting you with medication too, along with the ear cleaning every 2 weeks. How has been your sleep during these past 2 weeks after your last cleanup? So. How many hours per night are you sleeping? Okay. It's not the best, but it's still Not something that we can say that is very worrisome, but yeah, optimal will be 8 hours. So now, how about your headaches, migraines? That must be because of the pressure that you're suffering in your ears. Once it's relieved, I'm sure that it doesn't hurt anymore. Yeah, it's completely clear. Okay, let me walk you through to what we are going to be working on today. As you are already a veteran with ear cleaning, I'm sure that you're quite familiar with how the ear cleaning is performed with you. Now, the service that we provide here is, along with relaxation, is also a medical service. We have all the information from your doctor here, along with the medication that they are applying during the cleanup. Now, in your case, since it's a quite severe problem, it might take us quite a lot of time, because we are not only cleaning the exterior part of your ear canal, also the pores of your ear canal, which consists on scraping a little bit, pinching, and like you will do in your facial pores sometimes, in some places that they squeeze a little bit. That's what we are going to be doing on your ears too, to squeeze all the earwax that gets into the pores. And hopefully with that, we are going to, with time, be able to make the earwax production slow down just a bit, so you're comfortable and you're able to live a regular life, and especially be able to sleep. Okay, so we're going to start by doing an ear inspection. Let's see how they are doing right now. For that, we are going to be using a very special otoscope for this. This otoscope in specific has a camera attached to the pointy end right here. That is going to allow us to map your internal ear. Hopefully with this, we are going to be able to see the ear walls in big screen here and perform the ear mapping and the pore cleanup in your ears. Okay, now I'm going to be very close to you. Is that okay? Thank you. So let's check in here. Now your file tells us that you receive a lot of issues with clogged passage in the ear, impacted earwax. That happens quite a lot with you. Now this time it's just started to form. I can already see this area starting to form the walls. So we are in time to stop this. It's a little bit hard, but not too much. I'm able to inspect the inner ear. Yes, the production started maybe 2 days after your cleanup because it's quite full. Now in your file it says that you struggle a lot with redness in the ear walls. Now this is something that is quite delicate because it can prevent you to live a normal life, walk in a normal way. Have you suffered from dizziness or feeling like, oh, the floor is moving a little bit? Yeah, it's all linked to the ears, so we're gonna be very thorough with this cleanup, especially on this section right here. Ooh, yeah. Now let me just check here on the computer. That's a very good picture. Let's try to get more, okay? I'll try not to move, and hopefully we get good shots. Good, good, good. Very good. Okay. That's a good one. Let's see this ear, okay? Now I would say that it's almost the exact same as the other ear. The impacted earwax is just started to form now in this area. Looks like a lot. This ear looks like it's getting more earwax than the other, and I do notice in your file that that never happened before. It's almost copy paste from one ear to the other, but seeing that this one is getting a little bit more. I hope that this is just a one-time occurrence and nothing that can lead to a major problem. Okay. Does it hurt when I press certain areas? Okay, good. Very good. So overall, it does seem that it's advancing quite fast. Yeah. It's quite natural for you. I have only seen one other case like yours. Well, not as severe, but we are treating this person almost the same. So I'm pretty sure that it's gonna be a similar procedure for your cleanup. Now for you, I would like to say that at least 30 minutes, if not more, from what I'm seeing, especially on the camera. Okay, let me just check something out here. Do you have any discomfort while I'm doing this? How about this? Any weird sensation? Okay, now how about this area here? You twitch a little. What do you feel? Pain, discomfort, tingles, ticklish? Okay. How about there? Okay. This ear seems a little bit more sensitive than the other one, which it could be causing something else. That's why the overproduction in this one is a little larger than the other one. Okay. So from the prescription that we have from your doctor, we're going to be applying this medication along. Okay, we're going to have to apply some injection inside your ear canal. This can be uncomfortable, but don't worry, we are going to be applying a numbing solution in your ears because it tends to hurt. So I don't want you to feel uncomfortable for that, okay? Let me just bring it, okay? Just 1 second. Now, this treatment tends to be a bit difficult, but don't worry, I'm an expert on this, and we are going to be finding a way that it's not going to hurt you, okay? Don't worry. I don't like scaring my patients, but also I don't want to tell them that things are gonna be easy and then they get a surprise, because it gets a bit uncomfortable. So, okay, let's start with the numbing solution. This doesn't hurt, doesn't feel absolutely anything, just a bit wet, which I'm gonna apply it like this. I'm gonna try not to move, okay? It's oily, but it gets absorbed quite fast. Let's do the same on this ear. Okay, give it a gentle push. There we go. Let's wait a minute. Now let me show you the needle that we are going to be using. As you can see, it's very, very small. You really are not gonna feel it once we finish with the serum that is gonna numb the area. But I just wanted to show you how it's gonna be. This is gonna be done. Oops, I'm sorry. Keep jumping. This is just a sample needle, so I can show you. This one I'm gonna be using while we're cleaning your ears. So during that time, as I see in your chart, you tend to sleep during the process. You're a veteran about that, so I'm sure it's actually relaxing for you. So you're really not gonna feel it, especially with the numbing solution. There we go. Normally it takes a couple of minutes to work out. Just want to make sure that it works well. Let me take a look again with the camera. Do you have any discomfort? Pain? Good. That's a good picture. Quite nice. Okay. Yeah, you can actually see there all that earwax buildup. Your ears have a busy life. Yeah, I know that. You're so used to it. It's funny how the body works with this stuff. Okay, let's check here. Any discomfort, pain? How about here? Okay, that's good. It's almost ready. Now with this, we are gonna have to pass you into the cleaning area, which is in a sterile room. Right here, it's clean, but there might be dust specks flying around. And what we're trying to avoid with your ears is getting more dust or matter that goes into your ears, because still we don't know, this could be an allergic reaction, an exaggeration of your body due to dust, water, or we still don't know. So we're gonna go to the sterile room, and there we're gonna lie you down and start working on your ears. Okay, just need to make sure that they are looking good and ready for the procedure. Now, before we go in, I'm gonna ask you a few questions, and then I'm gonna ask you again. Right now, do you have any pain in your ears? Can you describe it for me, please? Right now, do you have any other sensation in your ears besides pain? It could be that it feels hot, that it tickles, anything like that. Okay, good. Right now, do you have a headache or a migraine? Very good, thank you so much. Now let's make sure that you don't have any sensation, okay? I'm gonna be touching the side of your ear. Let me know if you can feel it, okay? Let's start in this area. Can you feel I'm touching this area in particular? Okay. How about here? And here? Good. Let's try this area. Can you feel here? And here? How about here? Very good. Okay, so we are gonna be looking at the screen here when I show you the result of the mapping of your ear. Now, I don't know if I don't see it in your file, if you ever had a mapping of your ears. Okay, this is not a 100% map of your ear, only of this area in particular where we're going to be treating you. But there you can see an issue. There's a little bump. Have they told you about this before? No? Okay, this bump, when it's pressed, is releasing sebaceous substance, which it can create the earwax. It looks kind of like a pimple, but it's not. It has some bone structure there when it's pressed. There we go. You can see it in that frame right there. It's like it's calcified. Have you ever had an accident that was involved with your ears? Maybe getting a pencil in, or I don't know, a knife, something pointy going through your ear when you were a child, something like that? Now that you can remember. Yeah, sometimes it happens when there are puncture wounds that touch the bone, that the bone starts fixing it with their cells, and it leaves like a little bump while they're fixing it. But with time, that is completely fills and gets back to its normal self. But in some cases, that doesn't happen and leaves these little bumps. Now right here in this picture on the other ear, you can see the difference. There is no bump here. So maybe it's not related at all, but it could be a cause of your problem. Right now, the only theory that we have is an exaggeration of your immune system to the external material that is flying around or that goes inside your ears, and it's creating this overproduction of earwax. Okay, so I think we are ready to go to the area. If you can follow me, please. This way. Okay, very good. So you're gonna be lying down in this position. Now you notice that your head is placed in a kind of like concave area, like a cocoon. This is so your head doesn't move while we are making the cleanup. It feels comfortable, isn't it? Yeah, like a little nest for your head. Now, during this time, as you know, we are not gonna be talking or anything because of the tools that can be dangerous and can create more issues. If you need anything, please let us know beforehand. Again, be aware of sneezes, or if you feel the need to cough, please let us know. Are you comfortable like this? We can still move your head a little bit more. Okay. We have the option to put on a face mask in case that you want to sleep or take a little nap, or you're just okay with this. Okay, good. So, while we're doing the cleanup, we'll also be injecting the medication that your doctor prescribed for you. Hopefully, with this, we're going to have a good outcome, making your wax to slow down its production, and it doesn't go as fast as it normally is, okay? So, are you ready? Very good. And okay, let's start by working with this. Thank you. Hi. How are you feeling? Good? You pass out completely. I love when my patients go through that. It's so relaxing for them. Feel good? More relaxed, I bet. So, let me tell you about what we saw in your ears. That bulb that I was talking about, it was a sebaceous clot that we were able to extract. That was something that wasn't there before because I don't see any notes about that in your medical file. So that could be a recurrence. Sometimes people get pimples inside their ears. It's quite common. For other people, it's one in a lifetime. So maybe that's what happened here. Nothing to be worried about. So we were able to extract it. It was all good. It was quite full, to be honest. It was fun. It's always fun to find these anomalies that doesn't hurt the patient, but it's interesting to find them. And now we were able to inject the medication that your doctor prescribed, and I see that you have an appointment in 2 weeks with your doctor. So from there, they are going to examine your ears, and I was putting some notes in your file to make an observation that it will be a good idea to have a complete ear mapping in both ears, complete with bone, external area, internal area, everything. That way we're going to be able to know how your ear is functioning and run some simulations in the computer and hopefully find other solutions for this issue. Okay, so that will be it for me, and I don't know if you have any questions. Well, everything else will be answered by your doctor, and I think we will be seeing each other again in 2 weeks too, after your appointment with your doctor, or else what they tell you. It was my pleasure. Please take care, and I will see you. Bye-bye. Well, hello there. How are you today? I'm doing fine. Thank you for asking. Okay. We have something big prepared for you today. I see in your last ear cleaning was mostly for the external part. I do notice that there is a note that they found something odd in one of your ear walls, which was like a sit. They told you about it? Very good. Now I was researching about this. It's sometimes common that it can happen in those areas of the ear, so there's really nothing to worry about. I want to start by checking how it has developed, and it's been a week, about 2 weeks, right? Yeah, it definitely has been changes. So let's see at the situation. Are you feeling discomfort or pain at the moment? Okay. Now we're gonna use 2 otoscopes this time for different sensitivities. In your case, we have noticed that even with cameras, it's been quite hard to map the area. Okay, so try not to move, please. Okay. Mhm. Well, the good news is that there is not impacted earwax present. That is quite good news. That tells us that the treatment that we have been doing has been doing some good. Still earwax, but softer than in other occasions, which is going to be a good opportunity to take a sample. Okay, you're going to have to scrap a little. Just make sure that the other one has the same, or we just need it for this ear, okay? Okay, good. Excellent. No impacted earwax either. That's a very good sign. Something that we're doing is good, okay? Earwax is also quite soft. Now on this ear I did notice a redness. Let me check it with this otoscope. Now we have two. The difference is that each one can look a little bit further into the ear. This one allows us to even go into the eardrum area, while this one just prepares us for the walls. So hopefully I'm gonna find something else here. Yeah, I do remember that you're quite experienced with this. Have you noticed the difference between the otoscopes? Okay. Now let's check here. Okay. We're gonna scrap. We are gonna scrap the area ever so slightly to take a good sample of the soft earwax production. Do you feel any pain or discomfort? Nothing? Okay, that's good. Very good. Let me just label it here. Now the redness present, that worries me, so gotta take a closer look once I take the sample, okay? Let's not move, okay? I'm not doing the sample taking when we do the full cleanup because we're gonna be using serums and products that will spoil the sample, so we want it to be as pristine as possible. Okay, let me sample it. No, I think we're gonna have to do an irrigation. Yes, I'm not liking the redness present, so definitely need to take a look into that. The irrigation is not going to completely clear your ears, but it's going to allow us to see more clearly that redness. And there is also like a bump, probably could be another set, but we don't know. Let me just start by plugging. This. Okay, good. might feel a little bit odd, even tingling. That is expected, okay? Let me massage your ears a bit, okay? Again, the sensation is gonna feel weird, but that's expected. But it doesn't need to hurt, okay? Good. Very good. 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 There we go. Okay, let's give it a little time and prepare the irrigation. Okay, so we're gonna be using a solution that is gonna clear the area and it's gonna turn the ear walls into a different tones. That is gonna be a sign that there might be a bacterial infection, or hopefully not a viral infection. If it's a bacterial infection, it's way easier to clear. No, don't worry, it doesn't hurt at all. Let's go start with this ear. I'm gonna protect your clothing. Might get a little bit wet, okay? Might spill around. Just gonna apply this to protect the area. Very good. So I'm gonna place this directly into the ear area. It's gonna feel a bit cold, okay? Let's try not to move. Ready? Let's try again. 1, 2, 3. Okay. Let's hope that the color doesn't change to red. We have a green. Can be clear off very easily. Red, more difficult because it means that there is a virus present. Okay, let's try not to move. Good. Okay, let's check with our close-up otoscope here. Okay, normally this does this quite fast. Okay, yes, there is bacterial infection. Have you been swimming on public pools, the sea, especially public pools like hotels, share pools? Okay. Yeah, sometimes we can catch up some bacteria from those places. Okay, let's check the other ear. But if this one has it, it's definitely that the other one is gonna have it. Yeah, it's the same. Okay. we have good news and bad news. Good news is that it's a bacterial infection, which is going to be easy to clear up. Bad news is, I don't know if you have enough time. Yeah, because this needs to be under anesthesia. Don't worry, we are not gonna sleep you completely, but you're gonna be sedated because the cleaning procedure that we're gonna be doing, it's more delicate than what we do and have done in the past with you because of the bacterial infection. We're gonna clear up completely the pores inside your ears. So it's definitely gonna take longer. And do you have anything to do? Yeah, because our appointments normally are between that time. Yes, it needs to be done immediately. That bacteria is gonna keep growing and growing, and it's gonna get more bad. Since we are ready when was gonna do their cleaning today, we can squeeze it in. Okay. Let me tell my nurse to prepare everything. You're gonna feel very drowsy. Do you have anyone to drive you? Or an Uber? Okay, because you cannot drive after this. You're gonna feel like normal in about 3 hours. Yes, and we're still in business hours, so you can come back and get your car in case you can't even car or transfer or someone brought you here. Very good. So I want to do a few testing before our nurse is ready for you and our anesthesiologist. Okay. See how is your hearing. I want to know if it was affected. Sometimes this bacteria can affect the hearing, and the hearing loss tends to be permanent. So hopefully it's not. Okay. Let me know if you can hear this. Okay. Very good. Once again. Oh, hello, nurse. You heard? So yeah, we're gonna prepare the room for that and call our anesthesiologist. Yeah, it's gonna be fast, just a level 1. Okay, so let me walk you through to what we're gonna do. Our anesthesiologist is just gonna administer something that is gonna make you feel very relaxed, like you're drowsy, like you feel very sleepy. Okay, it's gonna make you sleep, but not your whole body. It's not gonna numb your body completely. It's just to relax you and make our work a little bit easier, especially with the bacteria there. We don't want it to propagate. Okay, now during the procedure, the ear cleaning is as you normally will have it. Okay, and then we are going to be scraping. We're going to have to clean the ear first, and then we're going to be scrubbing and clearing up every single pore in your ear to get that little bacteria out. And then when you go home, you're going to be having a set of drops that probably for a week, and it's going to be completely clear. You have it ready. Okay, we're going to have room service 2. Okay, thank you. Very well. So that's gonna happen. Do you need to contact anyone? By Uber? Okay, that's great. Let me check the ear here. Good. Yeah, after you wake up, you're gonna be mentally great, but we don't want our patients to drive because there's still that little drowsy sensation that could be dangerous, like you drank half cup of wine. So we don't want anything like that driving. Okay, so you have it ready? Okay, very good. So let's go to the room 1 and we're gonna start from there. Okay, good. Okay, hello. I'm Dr. Murmullo. I will be your anesthesiologist. How are you feeling? Don't worry. Everything's gonna be fine. Right now we're gonna send you to the ear cleaning room. Right now, just gonna help you go to sleep, okay? Very good. Everything looks fine. Okay. We'd like you to breathe through this. Okay, just normal breathing. You're gonna feel sleepy, that's it. Very good. 5, 4, 3, 2, 1. Good. Yes, nurse, you can prepare it and send it to the cleaning room, please. Yeah, completely ready. Very good. welcome back. How are you feeling? Yeah, isn't it? A bit sleepy. That's fine. Do you want me to call anyone? Oh, they are already coming. Very good, thank you. Okay, so the sensation that you're feeling right now is gonna start fading away again in about 3 hours. You're gonna be like normal. Your ears are completely clean. The stage of the bacteria that you had was in level 1, meaning that it just started, so it wasn't taking root yet, which is great because it means that you don't need any medication. We were able to remove absolutely everything. Your ears are clear of any signs of bacteria. Now, I'm suspecting that the bacteria had something to do with not having your earwax collapse or getting into a rock sensation. So we're going to examine it. We took samples of it and we're going to examine it. And on our next visit, I'm going to give you the results, okay? Very good. Oh, they're here for you. You have any questions? No, that's it. That's all we need to do. We're just gonna have to see you in the next appointment. Yeah, right here in reception. Of course. Please take care. Bye-bye. Yeah, you can take them. Of course. Hello, welcome to Walmart. I'm Jonie. How are you? Please take a seat. Well, tell me, what can I do for you today? Oh, I'm so sorry. Oh, that must be very uncomfortable. Okay, well, before I can start with your examination, I need to gather a few information from you. Is that okay? Thank you. Is this your first time at the Walmart clinic? Okay, I'm gonna need your info, your personal information. Your name, please. Oh, that's a cute name. Very good. Okay. Your date of birth. Any known allergies, medication, food. Okay. Very good. So the reason for your visit is that it's because you feel that you have some issues with your ears. Can you describe me the symptoms that you're currently having? You feel dizzy every time you stand up. When you're driving too. Oh, that's dangerous. Okay. You have some headaches. Oh, migraines. That's much worse. Yes. You have some pain located in your ears. At the back. Oh, okay. That's the first time that I hear something like that. Very good. When did this issue start? When did you notice them first? Okay, you waited out. I'm so sorry that it's going through so much time. Very good, okay. So have you ever had an ear examination before? Okay, let me show you. I'm going to be using this otoscope to check inside your ears. It has a little lamp in it, a little light that allows me to see inside. Okay? Very good. Let me just prep you up. Sometimes there's a fallout, so we want to protect your clothing, okay? Just gonna put this on top. There we go. Okay, So this might tickle a little bit. I'm gonna be very, very close to you. Is that okay? Excellent. Okay. Let's start on this ear. Oh wow. Okay. There is quite a big blockage. Does it hurt when I press? I'm gonna do a little test, okay? Does it hurt when I do this? It's uncomfortable. But let's say in a scale of 1 to 5, 5 being that you cannot stand it, how will you rate it? About a 2.5? Okay, that's still a lot. It means that the blockage is actually pulling the inside of your ear canal. So we don't want that. No wonder you're in so much discomfort. Okay. Yeah, definitely a big blockage. It can definitely be resolved today, so don't worry about it. It seems to be an earwax blockage. Sometimes earwax, when it's not cleaned properly or when there is issues of overproduction where the earwax is being produced constantly, and we sometimes use Q-tips to try to clean that up. What we are doing is just pulling it all the way inside, and it gets hard, and in some people it gets so hard like a rock. It's called impacted earwax. It's almost like a little rock inside there, very, very hard, and the person is almost unable to remove it by themselves. So it's good that you came here for help. Now what we have to do here is completely dissolve it. Let's check your other ear. Hopefully it's better. Now, since you were telling me that you have waited quite a bit, I can see. Yeah, definitely. Yeah, it's the same issue here. We are gonna have to dissolve it, at least the entrance, so we can go inside. Once we go inside, we can do a full checkup of the ear canal. Right now, I cannot even go there because I tried to poke it and you were twitching a little bit, so I don't want to cause you any more discomfort. So what we're going to be doing first is apply a numbing solution in the entrance of the ear, because I have seen that you've been twitching a bit and I don't want you to feel like that, okay? So this cream is going to feel a little bit weird. It's going to feel first warm, then like a tingling sensation, and then like it's starting to numb, okay? Very good. So let's start with this area here. Now you're gonna start feeling that sensation that I was telling you about. Okay? Normally takes around a minute or two to completely numb the area. Okay. So let's wait that out. So I'm starting to prepare for you. We're going to have to use this tool here that looks quite scary. It has a very pointy end, almost like a needle. With this I'm going to try to open a passage so I can look inside your ear before starting the dissolving. I don't want to go with any medications before knowing that the inside of your ears is good enough to do this. If it's too red or there is presence of blood or pus, we are not going to be able to do. We're going to have to use another method and that it's different. But I just want to make sure that there is a fine area on your ear, okay? Let's just wait for the numbing cream to start acting up. Oh, the dissolving cream doesn't hurt at all. It's actually relaxing because it has a very relaxing sound to it, so you're gonna enjoy it, to be honest. Okay, let's take a look here. Okay, should be ready now. Let's test it out. I'm gonna poke you with this. Let me know if you can feel anything, okay? Ready? Can you feel this? Good. Can you feel this? Very good. Let's try again. How about this? Good. Very good. Okay, let's try to poke a hole. I'm gonna do it right in the middle. That way I'm gonna even know how wide is this earwax that is impacted, and if it's gonna need a little bit more of our serum to dissolve it. Okay, very good. Now during this time, please try not to move. Remember, it's quite pointy. Okay, very good. Here we go. Shouldn't be feeling anything. Okay. It's quite hard, very, very hard. Yeah, it's almost like I'm scrapping like a rock, ceramic. Okay, there we go. I have pretty good opening. Now I'm gonna be able to insert the otoscope and check inside, okay? Very good. Let's not move, okay? Okay. Oh, that's surprising. Good, good, good. Very good. Okay. Well, I'm saying that is surprising because looking inside your ear canal during this tiny hole, I was able to check and everything looks good. There's actually a nice pink color inside your ear. There is no presence of any infestation or blood or pus or anything, or even infection, so it's good. Probably you are suffering of earwax overproduction. Is something that tends to happen to some people, or maybe you're using Q-tips a little bit too much, but don't worry, we're gonna be able to remove it very, very easily. But we're gonna need a lot of serum to try to dissolve that entrance of infected earwax first. Let's check the other ear, make sure that it's the same as this one. Okay. This one is a little bit softer than the other side. Still quite deep. let's go take a peek inside. Okay. Yeah, same as in the other ear, which is good. Excellent. Okay. So I'm happy to say that your ears are in excellent shape beside the earwax. That could be completely random, or could be a sign that there is an overproduction of earwax. We don't know unless that we see this again in another session in case that you need it. Okay. So we are going to be applying this serum. What this is going to do is kind of dissolve this earwax that is quite hard at the entrance. You're going to hear like a bubbling sound. That is the earwax dissolving. It's not a acid or anything like that, so don't get scared. But you're going to hear that bubbling, that like sizzling sound, okay? Very good. So let's start on this area here. On this area here. You should be starting to hear the sound that I was telling you about in no time, okay? We're gonna give it about 2 minutes to start acting up. Then I'm gonna be scrapping that part. Now in your case, since there is a lot of earwax, we're gonna have to use a different method that is a little bit more invasive, but we're gonna lie you down and I'm gonna be working very precisely on each ear because you have a lot of buildup on each area. So normally for a person it takes me around 10 minutes to clean their ears. In your case, it's quite a lot that we have seen inside there. Normally, I would say 15 to 20 minutes, depending how it looks once I'm in there. But give it or take, that's the amount of time. Now, the dissolving solution that I applied is going to soften up the earwax quite a lot. So it's not going to be that hard to remove as when I don't use it on other clients. But this doesn't mean that it's not going to take too long. Many of my patients and clients tend to fall asleep. So it's okay if you tend to feel sleepy. Go ahead, take a little nap. I know it's a little bit relaxing, so it's okay if you fall asleep, okay? You're starting to hear it, right? Okay, so let me prep you up. I'm going to prep the things that we need for this, and I'll be back in a couple of minutes, okay? Okay. So in case that you need anything, just going to be here, picking up the things that we are going to be using on you, okay? Just going to move this here. have everything ready for you. I'm gonna prep you up. As I was saying, I'm gonna lay you down. Don't worry. Chair just pulls the weight up. Feel uncomfortable. There you go. Gonna put the light here so I can see you better. Okay. I'll lower the light for you so it doesn't blind you. There we go. Okay, are you comfortable in this position, or do you want me to lay you down a little bit more? It's fine either way, okay? Very good. Okay. Lower the light a little bit here. I'm gonna prep you up. Now during this step, it's very important not to move. I'm gonna be using this instrument that are sharp on some occasions, so please be aware of that. In case that you need to cough or sneeze, let me know so I can take them out. Okay, that's good. Okay, this way I can see you better. Very good. You ready? Excellent. So let's start, okay? Try not to move. I'm going to pull your chair a little bit more to the back. Good. Okay. Just gonna fix this for you. Hello, welcome back. You fell asleep. Well, that took us a little bit longer than expected, and you took a little nap. That's completely fine. You feel refreshed? Oh, your headache is gone now. Yes, definitely. That's because this was pressed into your eardrum. All this earwax accumulation was deep into your ear canal, and it was pressed directly into your eardrum. This sometimes, on some people, causes headaches, migraines, loss of balance, especially when you're standing up. So you stand up very fast too. So that was the cause. Right now, I would like to make a few exercises, if I may, please. Can you please stand up? Walk around a little bit. Let me know how you feel. If you feel that dizziness that you were telling me before. Okay. I did notice when you came in that you were walking a bit funny, and I don't notice it now. So it was definitely a balance issue. Right now you're walking quite well. It feels great, isn't it? Oh, sounds like you're hearing in HD, high definition. Yeah, definitely, because you had first this barrier of impacted earwax. It was a wall there. Then you had all this mushy earwax pressing against your eardrum. Yeah, it was a lot. So now you should be feeling much better, right? Okay, a few information. Let me show you. Most people use this kind of stuff to clean their ears. What they do is, let's say this is the entrance of your ear. What they do is insert it and kind of do this. But what they do is, when they insert it, they are pressing all their earwax to the end of the ear canal. So all the way into the eardrum. That's what happened here. I don't know how long you have been with this. When was your last ear cleaning? If you never had an ear cleaning by a professional, it probably has been months of years of accumulation of earwax into the ear canal and into the eardrum. So try not to use them inside the ear. You can use them to clean the exterior part. It's completely safe for that. If you want to clean the inside your ears, I suggest you to get something like this. You see how it's like a little screw here? What this does, you never go too deep. You go inside like this and go in circles. The earwax gets stuck in here, and then you just take it off. Which is different from the cotton swab that just pushes. This one is gonna just scoop it out. Okay, and that's gonna help you a lot with that. I don't know if you are able to come back again if you want, okay? This is not a doctor's order. I cannot place appointments for you because this is a Walmart clinic. This is up to you. But if you want, we can do another appointment. You can come to check your ears in about 2 months and see how is the ear production without using Q-tips or anything like that. And from there, work in maybe a treatment that can help you with that in case that there is an overproduction. Okay, very good. Is there anything else that I can do for you today? It was my pleasure. Thank you so much. You can pay just here outside. There is a electronic kiosk, and with this number, you just pay there. Okay? Very good. Thank you so much, and hopefully I will see you again. Bye-bye.